Welcome to 7 Steps to Obtaining a Medical Interpreter with MiTio. I'm Dr. Nelva Lee, your presenter today. Who is this webinar for? It's for clinics who are looking for trained and qualified medical interpreters, hospitals and healthcare organizations looking for a cost-effective solution to their interpreting needs, stakeholders that are in need of a quality virtual solution, stakeholders wanting a guaranteed connection with a video or audio interpreter within seconds, and also stakeholders in need of any of our 200 languages for their facilities and only want to pay for the actual calls made. So in the next 25 minutes, I'm going to explain to you how to obtain a plug-and-play interpreting service that is cost-effective and intuitive to use on day one. And I'll also explain how to obtain a high-quality virtual video and audio interpreting platform with no additional equipment that meets your HIPAA standards. We will also explain how to obtain trained and qualified interpreters in over 200 languages in as little as 30 seconds, and how to save on the overhead costs, such as travel expenses, and receive the best in industry qualified interpreters for your patients. Basically, this webinar will explain everything that you need to know so that you get a trained and qualified virtual medical interpreter in as little as 30 seconds. This is not a gimmick. This is not a do nothing but click a button process. This is not how to get fake medical interpreters. You must be in need of a fully bilingual in both English and a target language medical interpreter with a minimum of 60 hours training under their belt. You also need to be willing to explore a more comprehensive and turnkey system and be willing to abandon the notion that only in-house trained interpreters are qualified. And lastly, be willing to outsource the training and qualifying functions to a proven provider, such as MiTio. Does this sound like you? Do you have patients and clients with languages that your bilingual staff do not speak? Do you have on-staff interpreters that are not able to handle the volume of your interpreting needs? Do you secretly wonder if your bilingual staff are truly qualified and know what they're doing? Do you advertise for trained interpreters, but most of your applicants are not trained? Do you work feverishly at recruiting bilingual individuals, but find out after testing that they're not in fact fully bilingual? Are you working with multiple online job sites and find that the quality of applicants has diminished? Do you know of other healthcare organizations or interpreting agencies with better success at recruitment and retention? And are you working too hard to train and retrain your bilingual staff and wish you had a guarantee when hiring an individual? Do you feel like every year the cost of recruitment and retention of qualified and trained bilingual staff keeps rising? Do you want to reduce the expenses for your company and still hire the best trained and qualified medical interpreters? Do you feel like there's an invisible ceiling on the amount of qualified individuals you can hire each year? And do you feel like you are ready to outsource the recruitment, training, and qualifying for your bilingual staff, but don't know how to start? So here's the real problem. You are stuck in the old model and haven't moved to the highly sought after and lucrative new model of partnering with a remote video and phone interpreting platform. When you move to the new model, that invisible ceiling on qualified medical interpreters will disappear, and you will have access to over 200 languages of qualified and trained medical interpreters in 30 seconds or less. You will not have to worry about the qualifications and ability of your bilingual staff. And you can do all of this while tapping into this turnkey system of MiTio while you eliminate your travel and benefit expenses of your face-to-face interpreters. You will also have the complete control over your expenses. You will be able to easily navigate your dashboard and invoices and know exactly who is requesting services in your facility, for what languages, and for what length. And you will be valued for your forethought and cost-saving progress. So, as I mentioned, my name is Dr. Nelva Lee. I was the first chair of the National Board of Certification for Medical Interpreters. I founded MiTio in 2004 with the express goal of providing a flexible and comprehensive medical interpreting services and training program. We specialize here at MiTio in helping bilingual individuals to become medical interpreters and providing them with placement for employment. Here's one of our clients. They said that the phone calls have been responsive and professional. This is from the Eagles Landing Family Practice. Amy Huber says, the quality of work and customer service support that MiTio provides to our patients is some of the best we've experienced. Everything has been smooth and phone calls have been responsive and professional. It is super convenient for a busy family practice such as ours. In times such as these, we find that anything that we can do online or from a distance is an easy mechanism to work with our patients and communication. Another one of our clients, the Cardiovascular Clinic of North Georgia, says MiTio provides interpretation services to CV-CNG for over a year, providing video and over-the-phone remote interpreting in as little as 30 seconds or less in over 200 languages to various locations throughout North Georgia. And Aviator Home Health says MiTio meets the occasional need for interpreting services. No monthly payments, no annual payments. You only pay for the actual calls made per month. Wellstar, a large healthcare system, has trained their bilingual staff and interpreters through MiTio. Back in 2014, they trained over 100 interpreters, and 89 of them graduated in January of 2014. Here's one of those graduates. She went on to become the coordinator of interpreting services at Grady Health System. And she's an ambassador for MiTio in our training programs. Her name is Kippy Lipham. Heartland Alliance also trains their interpreters on an ongoing basis with our licensing program. And Lang Consult, a company that's based in South Africa, also trains interpreters and actually hires medical interpreters from the MiTio program. And that's just a start. In the past 16 years, MiTio has trained over 1,000 medical interpreters, and that they can then go on to work as qualified experts in the field, so that when you partner with us, you obtain quality and expertise that you deserve. Here are the 7 steps to obtaining a medical interpreter through MiTio. Step 1, first of all, please stop using bilinguals in a healthcare or medical setting if they are not trained interpreters, okay? Both the Office of Civil Rights and the Joint Commission of Accreditation requires that hospitals only use trained interpreters. Healthcare facilities can actually run the risk of lawsuits and fines for using untrained individuals to interpret. Hospitals must abstain from using untrained bilingual staff members, as well as children to interpret medically, family members, ad hoc medical personnel, etc. And many hospitals are now requiring certification in addition to training for their medical interpreters. Kudos to them. In order to sit for certification, interpreters have to prove that they have been trained by an accredited program, and MiTio is an accredited program. HealthLink, another hospital, also has trained over a dozen of their medical interpreters through MiTio. Step 2, you must prove proficiency. So in order to employ a qualified medical interpreter, you must prove their proficiency. Proven proficiency is a process. And here at MiTio, we use the same system that the certification bodies, CCHI and NBCMI, use to prove proficiency. That is, a person has to provide a high school diploma from a country where the language is spoken, or 15 credit hours from a college or university for that language. If they do not have either one of these, they must also prove that they have completed a test and with a pass score of advanced or higher, and from one of the approved testing bodies. Memorial Health trains their medical interpreters through MiTio's licensing program. It's important, by the way, to qualify your interpreters or your bilingual staff's bilingual ability, because just because someone tells you that they speak a language does not mean that they actually speak a language fluently enough to interpret. Third, training must be from an accredited training program. So there are many training programs out there, but very few of them are accredited. If you accept training from an uncredited program, you run the risk that your interpreters or bilingual staff are not really prepared for the rigors of the certification exam or the rigors of the job as a medical interpreter. MiTio is accredited by both IMIA and NPEC. IMIA stands for the International Medical Interpreters Association, and NPEC is the Non-Public Education Commission. With our CEUs being accredited by CCHI, allowing for our courses to be rigorous and comprehensive. We have a proven track record of our alumni obtaining their certification through either CCHI or NBCMI. And we have a proven track record of our alumni obtaining employment, specifically as we have our agency that employs most of our alumni. Ochsner is another healthcare organization that has trained over 20 of their medical interpreters with MiTio's licensing program. Step 4, obtain a trained and qualified medical interpreter in 30 seconds or less. So there are many interpreting platforms that have long waiting periods to locate qualified and trained medical interpreters. With MiTio, you can obtain a trained and qualified interpreter in over 200 languages in as little as 30 seconds or less. A lot of platforms also will charge you for a monthly fee or an annual fee. With MiTio, you only pay for the calls that you made. So you can obtain this trained and qualified individual with a satisfaction guarantee. The University of Maryland also trains their interpreters through us. They have trained over 16 of their medical interpreters through our licensing program. Step 5, obtain a guaranteed medical interpreter. So not only do we hire and train medical interpreters with great care, but we believe that your satisfaction is imperative for a good partnership. So upon completion of every single call with a trained and qualified MiTio medical interpreter, you will be given a call rating system. So if during the call you find that the interpreter was not a good match, you can rate them immediately, and we encourage you to do so. So you can rate them on their quality and on their presentation. And you will never obtain interpreters with low ratings. So we encourage you to rate each and every one of your interpreting calls. Step 6, get your first medical interpreter. So once you obtain an invitation to our platform, you will gain immediate access to our qualified and trained medical interpreters. MiTio provides access to over 8,000 interpreters for over 200 languages in as little as 30 seconds or less. So you will get an interpreter and a qualified one quickly. So we provide all of the training and onboarding to your team. You don't have to get any special equipment. You can use a laptop, a tablet, a smartphone. As long as it has video or audio connectivity, you're good to go. All that is needed to connect by video or audio with our trained interpreters. The U.S. Oncology Network has also trained 7 of their medical interpreters through our licensing program. Step 7, train and qualify your bilingual staff. So you've heard of all of our other partners that have either used our interpreting services platform or have used our licensing training program for their bilingual staff. So we definitely recommend that you train and qualify your bilingual staff. So after you have accessed our incredible platform with a network of over 8,000 interpreters covering over 200 languages, be sure that you also train and qualify your current bilingual staff. Our licensing agreement for our courses gives you the opportunity to train all of your bilingual staff at a discounted rate from the published tuition. So it's imperative that you have the peace of mind in the bilingual ability of your staff and in their understanding of interpreting protocols, medical terminology, standards of practice, everything that goes into being a good interpreter. So if you're going to use them in the capacity of medical interpreting, please make sure that they are trained. Now you basically have 2 options at this point. Option 1, continue with your failed and expensive interpreting efforts. Option 2, obtain trained and qualified medical interpreters through our turnkey platform. If you're smart and you go with option 2 and decide to obtain interpreters with MiTio, here's what we can offer you. First, you can begin the program immediately after you complete our onboarding process. You can complete the onboarding process in as little as 45 minutes during our call. You can obtain an invitation for the platform, you accept the invitation, and you make your first call, all within that 45-minute time frame. Upon completion of your first call, you can rate your interpreter and your overall experience using our system. It's that easy. And that's just in your first call. So if this sounds like you and you want to have access to our qualified and trained interpreters for over 200 languages, over the next 5 days, I've set aside some time to talk to you and see if I can help. This call will probably be the most valuable 45 minutes you spend on your recruitment efforts this year alone. So again, who is this call for? For clinics looking for trained and qualified medical interpreters, for hospitals and healthcare organizations looking for a cost-effective solution to their interpreting needs, for stakeholders in need of a quality virtual solution, stakeholders wanting a guaranteed connection with a video or audio interpreter within seconds, and stakeholders in need of any of our 200 languages for their facilities and only want to pay for the actual calls made. So please schedule a call below. There are over 230 people a week who log on to this webinar, and my schedule can handle only 14 calls over the next 5 days. So please schedule a call now. Thank you for your time.